Hi, this is Dr. Tamra Harville. I'm going to talk about implied main ideas or implied central ideas. They're a little bit more difficult than a stated main idea because that's like a thesis statement you can pull directly from the reading. If it's implied, you kind of have to put it together yourself. So I'm going to help you with that. So implied main ideas, they are a little bit more difficult. You have to read all the passages and determine in your own words what their point was. Sometimes it can be as simple as just sticking two of their sentences together, or maybe getting one of their sentences but adding the topic to that sentence because it's just a pronoun or something. But I'm going to show you some different ways to help you. What a main idea needs is it has to be a complete sentence, not a question, not a fragment, not a title, a complete sentence. And it must include the topic of the sentence. So here's a nice colorful visual. Main idea equals the topic and the author's overall point about the topic. Or here's your big idea, and the main idea is just a section about it. Okay. So here is a paragraph with an implied main idea. One of the most common sleep disorders is insomnia. Such things as noise, light, temperature, stress, nasal congestion, allergies, indigestion, pain, worrying, and snoring of a sleep partner are factors that contribute to insomnia, which affects about 58% of American adults in any given year. In narcolepsy, another sleep disorder, a person has sudden and irresistible sleep attacks that lasts about 15 minutes. Sleep paralysis sometimes accompanies narcoleptic episodes. Apnea is a dangerous sleep disorder in which the air passages are obstructed, causing cessation of breathing as often as 10 times an hour or more. This dangerous disorder can lead to high blood pressure, heart attacks, and strokes. Two other deep sleep disorders, sleep terrors and sleepwalking, occur during deep sleep and are more common among children and may be related to immaturity of the nervous system. So if you look at the nice italicized words, they're helping, but insomnia, this entire thing might be about insomnia, but then narcolepsy is not insomnia. It's another issue with sleep, right? Apnea, sleepwalking, night terrors. There's a bunch of different topics. So what is your main idea? Could it be that many factors contribute to insomnia? No, because there's more than just insomnia going on. Could it be a number of sleep disorders have been identified? That's a possibility. Apnea presents several dangers to a person who has it. While that may be true, is that what the entire paragraph's about? No. Or several sleep disorders are more common among children. Well, only those last couple of ones were among children. So your best one is the second one. Another example. When serious problems exist between various family members, family therapy should certainly be considered. It should also be considered when an individual's therapy is slowed by the family member or when a family member is not adjusting well to the improvement of the person in therapy. Not all families, however, will benefit from such therapy. Some family members, for example, may not be willing to cooperate, and without them, meeting as a family may be fruitless. Or one family member may take so much of a session's time that the therapy as a family cannot succeed. In such cases, other types of therapy may be useful. So we know that the topic is all about family therapy, but not a single one of these is the perfect sentence for it. So which one's the best one? Family therapy will only work when family members are willing to cooperate in therapy. That was mentioned, but is the entire thing about it? Family therapy has advantages over many other types of therapy. Didn't really talk about other types of therapy, though, did it? Various types of therapy can help people. Again, it was mostly talking about family therapy, right? And then family therapy may be helpful in some situations, but not in others. Of these, I think the last one is the best one. Oh, I hate this paragraph, but it's information. A broiler, which is the name of a chicken raised for its meat, typically has no contact with its mother. Instead, it is incubated in a hatchery until it breaks out of its egg. Then it is immediately moved to the floor of a broiler house, crowded with 20 to 60,000 birds. Because of the limited space, the birds frequently climb over each other. Most buildings are not equipped with adequate ventilation, so the animals suffer from extreme heat and sometimes suffocate. The environment is also unhealthy because the factory is only cleaned every 2 or 3 years. To counteract the unsanitary conditions, factory owners give the birds regular low doses of antibiotics. They also overfeed them to ensure that their breast tissue grows as fast as possible, which may damage the bird's hearts and other supporting parts, especially their legs and abdomens. Sometimes chickens become too ill to stand. The average broiler is slaughtered between the ages of 4 and 10 weeks, and shortly afterward it appears on your plate. So these are those chickens that you see rotisserie at different supermarkets and stuff. You notice they have a bigger breast than legs and stuff like that, and they're mass produced. Look at all the bold. A broiler, which is the name of a chicken raised for its meat, has no contact with its mother, crowded, extreme heat, suffocate, unhealthy, antibiotics, overfeed, unsanitary, damage, ill. A lot going on in this paragraph, right? So the topic, well, we know it's broilers, but it's not extreme heat in poultry houses or unsanitary conditions. There's a lot more to it. So what's the most important point the author's trying to make? Well, the poultry industry raises broilers, yeah. Conditions are unsanitary and harsh, true. Farmers can be cruel to chickens, but not all are. Chickens may not be good for us. Try to combine then what you think the best topic is with the overall point the author's trying to make. Here we have the poultry industry raises broilers, chickens raised for their meat, in unsanitary, harsh conditions that are not only cruel to the birds, but may make them harmful for humans that consume them. So in a nutshell, that kind of takes a little bit of all those points and puts it down into one. And then check yourself. Make sure it is a complete sentence, that it does contain the topic, that it's the overall point that everything is discussing. All the other sentences are introducing it, explaining it, or supporting it in some way. And then once you get all that together, you should have a firm understanding of what that main idea is. Thank you.